Well, good afternoon, everyone. My name is Ryan Patrick. I'm the United States Attorney for the Southern District of Texas. I want to welcome everyone up here today for a healthcare fraud strike force opioid takedown that happened this morning in the Houston area. But first, I want to introduce the folks up here. I'm joined by Assistant Attorney General from Washington, D.C. He came in for this event today, Brian Benskowski from the Department of Justice's Criminal Division. Also is U.S. Attorney John Bash, my counterpart from the Western District of Texas. Also is DEA Associate Special Agent in Charge, Jeffrey Scott. Executive Assistant U.S. Attorney Brett Featherston from the Eastern District of Texas. Department of Health and Human Services, Office of Inspector General Special Agent in Charge, C.J. Porter. Right there. FBI Houston's Assistant Special Agent in Charge, Ed Michelle. FBI San Antonio Assistant Special Agent in Charge, Stephen Camp. U.S. Marshal Gary Blankenship for the Southern District of Texas, and Houston Police Department Narcotics Division Commander William Staney. We're here today to make two announcements. First was a significant takedown involving Houston drug trafficking networks responsible for diverting over 23 million pills in the Houston area. In Houston, we are unfortunately known for what's called the Houston cocktail. That's a combination of hydrocodone, Xanax, and Soma, and also the proliferation of oxycodone. These cases are the result of the work by the Criminal Division's Healthcare Fraud Strike Force, which we're going to get into detail. That's the second part of this announcement today, and operates out of our offices here in Houston. The Strike Force has charged 41 individuals in 9 indictments in a network of what we in Houston refer to as pill mills. These are generally doctors, physician's assistants, and nurse practitioners who write prescriptions for these controlled substances that have no medical necessity, no medical reason. The checkups, the doctor visits as they are usually very perfunctory, and it's a typical cash and carry business. You pay your cash for the prescription, and then you go to a pharmacy that is usually all part of the same network. Included in this are medical providers, clinic owners and managers, pharmacists, pharmacy owners and managers, and drug dealers and traffickers. The DEA also executed 36 warrants, including 15 pharmacies, 6 clinics aimed at disrupting the same opioid diversions, and 9 suspension orders for prescribing authority. This unit is led in conjunction with the Southern District of Texas, the Eastern District of Texas, the District of Massachusetts, the DEA, and the FBI. Today we're also going to announce the creation of a new task force, one that operates here and in many other districts. This healthcare fraud strike force is a joint law enforcement effort that brings together the resources and expertise of healthcare fraud units, U.S. attorneys' offices, law enforcement partners that are all up here today. We are also expanding this into the Rio Grande Valley in conjunction with the Western District of Texas. This will be the 24th such of these strike forces put into place. So I now turn it over to Assistant Attorney General Brian Benskowski. Thank you.
Good afternoon. Thank you all for being here. America lost 68,500 lives to drug overdoses in 2018. And although that number was slightly lower in 2018 than it was in 2017, each of those deaths stands as a stark reminder of the lives, families, and communities ravaged by drug addiction. And I firmly believe that we can and we must do better in the fight against drug abuse, including prescription opioid abuse. It is my privilege to stand shoulder to shoulder here today with U.S. Attorneys Brian Patrick and John Bash, our law enforcement counterparts, to announce the latest chapter in our fight against those who unscrupulously pump this poison into our communities. The book is still being written, but make no mistake about it, the Justice Department is going after the criminals who peddle opioids for profit, and we're going after them aggressively. Thanks to the fantastic work of the Criminal Division's Houston Healthcare Fraud Strike Force, in collaboration, close consultation, and partnership with the U.S. Attorney's offices for the Southern and Eastern Districts of Texas and Massachusetts, today we're announcing federal charges against 41 criminal defendants. As Ryan noted, our law enforcement partners have, as of this morning, executed 36 search warrants in connection with these cases, including at 15 pharmacies and 6 pill mills across the Houston area. And as a complement to these criminal proceedings, the Drug Enforcement Administration has served immediate suspension orders on 9 registrants involved in these cases, including 7 pharmacies and 2 doctors. want to remind everyone, of course, that the conduct I will be discussing here today are merely allegations, and the defendants in these cases, as in every case, are innocent until proven guilty. Today's defendants include 16 medical professionals, all of whom are charged with felony controlled substances violations, and whose ranks include 4 doctors. They include a Houston area doctor who in less than 15 months allegedly prescribed approximately 2 million pills of controlled substances, including over 800,000 oxycodone pills and almost 450,000 hydrocodone pills. And they include another Houston area doctor who in less than 20 months allegedly prescribed over 800,000 doses of oxycodone. They also include the owner and pharmacist in charge at a pill mill pharmacy that has in 2019 allegedly dispensed the second highest amount of oxycodone 30 milligram pills of all the pharmacies in the entire state of Texas, and the 9th highest amount in the nation. Amazingly, 100% of the oxycodone dispensed by this pharmacy, every single oxycodone pill that left the premises, was in the highest available dosage strength of the drug. Today's charges in total involve over 23 million pills of oxycodone, hydrocodone, and carisoprodol, the equivalent of an opioid dose for every single adult living in the state of Texas. And it includes pills that were illegally prescribed here in Houston, but were diverted all the way across the country to the streets of Boston, Massachusetts. A new phenomenon in our war against the opioid crisis. This takedown is a testament to the enduring success of the Department of Justice's healthcare fraud strike force model. Demonstrates yet again the power of combining data analytics on the one hand with the use of traditional law enforcement investigative techniques on the other to systematically move cases from investigation to indictment. And it proves the success of the strike force model, that working collaboratively with our partners among agencies and United States attorneys' offices makes for stronger, bigger, and more impactful cases. Today's takedown also builds off of the tremendous momentum generated by the department's most recent efforts in other parts of the United States. In the Appalachian Regional Prescription Opioid Takedown in April of this year, we charged 60 defendants across 11 federal districts. In the National Healthcare Fraud and Opioid Takedown in June of last year, we charged 600 defendants across 58 districts. And as today's action makes clear, our work, particularly in regions with the greatest need, continues unabated. Our prosecutors continue to use all the tools and all the data at our disposal to tackle head-on the hot spots where prescription drug overdoses are occurring. And I have a message for those doctors, pharmacists, and other medical professionals engaging in this criminal behavior across the state of Texas and elsewhere in America. You may think you're invisible, but you're not. The data in our possession allows us to see you and to see you clearly, no matter where you are. And if you behave like a drug dealer, we're going to find you and treat you like a drug dealer. So in that regard, and in addition to today's law enforcement action, as Ryan noted, I'm also pleased to announce the creation of a new healthcare fraud strike force in the Rio Grande Valley and San Antonio, part of both the southern and western districts of Texas. The Rio Grande Valley San Antonio strike force will include 5 new prosecutors to laser focus our efforts in Texas to prosecute dirty doctors, clinic owners, pharmacists, and drug dealers. Ryan and John, I'm very much looking forward to working with both of you in expanding our work across your districts to help the communities in your districts. Creation of the strike force sends a crystal clear message to those in the Rio Grande Valley and San Antonio who are prescribing, dispensing, or diverting opioids without legitimate medical purpose. You'll be held accountable for your roles in the deadliest drug crisis in this nation's history. The Department of Justice will identify you and prosecute you to the fullest extent of the law. I'd like to turn the microphone over to John Bash, who will say a few words as well about the strike force.
Hi, I'm John Bash. I'm the United States Attorney in the Western District of Texas. I want to start just by thanking Attorney General Barr and Assistant Attorney General Benjikowski for setting up this new Rio Grande San Antonio Healthcare Fraud Task Force. That means additional resources to our offices to fight this scourge in our community. When you think about healthcare fraud, it's not just an ordinary white-collar fraud issue. It's not just about defrauding some company or some individual. It's really about the health of the citizens of Texas. Whether you're talking about prescribing opioids that people don't need and that are highly addictive but that result in tens of thousands of deaths a year, or performing unnecessary medical procedures, or just driving up the cost of healthcare. There's a healthcare debate in this country, and there's a lot of people with a lot of different views, but I think the one thing we all agree on is that healthcare costs shouldn't be driven up by fraud and criminal activity. And that's what this is all about, getting those costs down, getting the fraud out of the system. My office has been fortunate to do some amazing prosecutions even in the last year in the healthcare fraud space. In February, we prosecuted a pharmaceutical representative who was paying bribes to medical providers to prescribe unnecessary compound prescriptions. So you have patients getting unnecessary specialized medication. There again, you see both an economic component and a health component. We had a person who owned a business for physical therapy that was billing for professional physical therapists, and really these were just unlicensed people with no expertise. Again, there's an economic component to that, there's a healthcare component to that. So this is really about protecting the healthcare of every individual in Texas, and certainly every individual in the San Antonio, Austin, Rio Grande Valley area. I'm very excited, the team with Ryan Patrick and with Ryan Benjakowski. And I also want to thank the amazing career staff. You guys see us up here, but there are career staff at Maine Justice. There are assistant U.S. attorneys in our offices that have been fighting these battles for years, and they've been integral to building up these task forces. This is only the latest example, and we're going to make a lot of difference for a lot of real people in our communities. With that, I want to turn it over to Special Agent Scott from the Drug Enforcement Administration.
Thank you. This was a complicated operation with many moving parts, many of which are actually still moving right now as we stand up here. It's a credit really to all the agencies and investigators and our prosecuting partners involved that we're here today, and I'll try to do justice in the short time I have to the incredible work that they've already done and that will be ongoing throughout the day and in the weeks to come. Starting in late 2017, DEA's Galveston resident office and our Houston diversion and tactical diversion groups, in conjunction with other federal, state, and local law enforcement agencies, initiated Operation Hip Hop, targeting Ricky Moten, erstwhile rapper and studio owner and a longtime leader of a local heroin and cocaine trafficking organization. And what we later learned to be revealed to his ties to a Houston-based network of pharmacies, clinics, doctors, and other individuals responsible for operating and supporting several pill mills. As you've already heard, these pill mills, so-called pain management clinics, routinely engaged in prescribing and dispensing controlled substances, primarily oxycodone, outside the scope of professional practice and without legitimate medical purpose. More specifically, the pill mill operators and owners employed crew leaders, who in turn recruited numerous runners to pose as patients, turning a profit from the cash fees charged for each office visit. Further, patient runners concocted fictitious symptoms and medical complaints in order to obtain thousands of illegal scripts and pills from the pharmacies identified today, pills that were then distributed by Moten and his associates to targets as far away as Boston. As of today's arrest, we believe these pill mills were responsible for distributing over 23 million dosage units of what's been called the Houston cocktail. You've already heard about that. Clearly, the diversion of dangerous opioids is a national public health epidemic, crippling many communities throughout the country. Houston is unfortunately no different. What makes matters worse is when the individuals responsible for our medical care are also supplying lethal drugs. We at the DA believe that many of those arrested today are little more than drug traffickers in lab coats. And Operation Hip Hop, highlighted by the unique convergence of several diversion investigations with one of our more traditional cocaine and heroin cases, puts this in stark relief. To make it clear, the original Moten case revealed an organization that had moved beyond classical street drugs to diverting and distributing opioid-related prescription drugs in excess of 10,000 dosage units a week, because these prescription opioids proved just as lucrative, if not easier to obtain, than heroin and cocaine. As part of this morning's enforcement efforts, we've made at least 38 arrests, executed 23 Houston area search warrants to include the multiple pharmacies and clinics we've already discussed, and at least as of a few moments when I walked up here, we've seized 20 vehicles, 9 guns, and nearly $200,000 in currency in the various locations that we're still currently searching. Although today's arrests have dismantled this particular criminal enterprise at all levels, DEA and our law enforcement counterparts will continue to target and crack down on unscrupulous pain clinics. finally, and again, I just want to emphasize that today's success is a direct result of the hard work and dedication put forth by all of our partners at every local level. Far too many to name. They fortunately know who they are. You'll be hearing about them more later. Thank you.
And with that, we'll take any questions.
You mentioned 38 arrests this morning. There's 41 defendants. Are there still 3 out there?
There's a couple that we are expecting to sell.
Yeah.
There's a couple that we're expecting self-surrender, and one of those indictments involved a same individual with a multiple count indictment.
And Special Agent Scott, there were a few addresses we have, specific addresses. I was wondering if I could ask you about them, if they were part of this. Ray, one is the Sunnyside Wellness Clinic on Edfield, another the Cornerstone Pharmacy on Bissonnet, 7255 Bissonnet, and 5909 College Park in Deer Park, Texas. Were those all part of this?
Yeah, I believe so, yes.
Okay, thank you.
And you brought up a good point. You had an address on Bissonnet. You drive down Bissonnet, Fondren, Harwin. That's not the only part of town where these clinics and pharmacies are operating. But you drive down there, and once you know what you're looking for, you see them all over the place. These places operate in broad daylight. And you get to some of these clinics early enough in the morning, you will see the lines wrapped around the buildings of people waiting to get in to pay their $100 or $50, whatever the case may be, to get that prescription. And then they go to the pharmacy. Sometimes they'll go to a Walgreens or a CVS, but oftentimes they're going to a pharmacy that's all part and parcel with this program. This operates in broad daylight, and when you know what it is, you can see it. And it's just a matter of manpower and putting these efforts together, all these great agencies together to actually take care of this problem.
And I can say we had a couple of the clinics actually had armed guards, and I've been to my Walgreens several times. I've never seen armed guards there, so these things do stand out.
I can make a quick point just associated with this, given our efforts around the country. This was a tremendous success here today, but it also reflects a type of operation that we haven't seen before in the opioid fight. Your typical fact pattern is doctors selling prescriptions for cash or other things of value directly to addicted patients in order to feed their addiction. This represents what we're seeing here today, something entirely different, which is an entire set of drug trafficking organizations using patients, individuals who really have no business even being in the doctor's office, in order to get prescriptions that can then get filled at pharmacies, working in conjunction with the doctors and the drug trafficking organizations. The pills are then amassed and in many circumstances diverted across the country to Boston, Massachusetts. It looks a lot more like a traditional, more sophisticated drug trafficking operation than anything we've seen elsewhere in the country today.
There are so many places across the state and other states, even in the Dominican Republic. Can you talk about how that all tied back to our area?
Well, I can tell you that the way we do these cases is we use a combination of data. We get data from various places in the government, Medicare, Medicaid, prescriber data, patient data. And that data is analyzed in Washington. In some instances, we get tips, local tips about what's going on the ground. And we take those tips and we analyze the data associated with the pharmacy or the doctor. And the data jumps off the page at you. That's how these cases are made. I'm not aware, maybe you know about the connection outside of the United States in this case. But typically in this instance, what we got were, as my friend from the DEA has noted, some tips, some information that because of another investigation that caused us to focus on the opioid side of this. And then we analyzed the data associated with these doctors and these pharmacies. And as I said, it jumps off the page at you when you see the data. The number of prescriptions, the strength of the prescriptions, the fact that these are cash operations, so you're not seeing a lot of requests for reimbursement from the government. I mean, there are several factors that then cause us to go in, and the DEA and their law enforcement counterparts go in and use traditional law enforcement techniques. They do site visits, surveillance, and execute search warrants. We do all sorts of things that then tell us what's going on inside those doctors' offices and at those armed, guarded pharmacies. and the case comes together very quickly in that way. But I sorry to give you a long-winded answer, but I don't know anything about the foreign connection, any kind of foreign connection in this case.
How did the doctor in Atlanta tie back to what was going on here?
He was in the state for very small amount of time per month, and also working from his office in Atlanta. And he was essentially the individual responsible for writing the prescriptions, oftentimes without even seeing patients.
Thank you.
Anyone else?
You had mentioned this is the 23rd, 24th strike force throughout the country. How does Texas, Southeast Texas, and these areas under the strike force compare to other places around the country who are suffering from the opioid crisis?
It's a great question. And part of that, I think, embedded in that is why did we choose this area? And we go where the data tells us the need is the greatest. I mean, we're not a government of unlimited resources, and so we have to make decisions in Washington about where to allocate our resources in order to be able to work in conjunction with our U.S. attorney counterparts around the country. So in the first instance, we looked at the data. The data tells us where the greatest risk for healthcare fraud is, where the greatest risk for opioid, this kind of behavior associated with opioids by doctors and pharmacists and healthcare providers. And what the data told us was that there's tremendous need in this area, in the Rio Grande Valley and San Antonio, in this part of Texas. And we've been in the Houston area for a long time. I think it's the second longest serving strike force in the Justice Department for healthcare fraud. So we've been in Houston for a long time. We're adding resources to Houston because the need is great here. But the data tells us that there are other parts of the state where we need to be. And so that's where we go with the limited resources that we have.
This operation this morning, did they all go without incident in terms of, you mentioned there were armed guards in places. Were there anything?
No,
bizarre?
fortunately, this morning's operation went fine. It was a long morning. We've had teams out and a lot of agents and cops with badges out very early this morning. So it's long, and we're still wrapping up some search warrants now. But there was no incidents. It all went smoothly. It's a credit to the guys out there on the street doing it. And again, I just want to kind of emphasize, because it's complicated what we laid out here, and what we really saw in this case is an investigation that went from the street back up into the pharmacy, and that's what we had not seen very often before. And our diversion program and the strike force had been looking at many of these pharmacies and clinics already. They were already on our radar. The data had already alerted us to concerns to them, but it was through this one investigation, quite frankly, that allowed us to kind of back up off the street, because that's where the pills were being distributed, and it gave us some of those routine techniques that we do, the surveillances and whatnot, that allowed us to actually connect this kind of spider web of clinics that we were kind of looking at individually, but we didn't realize they were all connected until we saw the street level distribution and the cross-state distribution that was going on.
Anyone else? Well, thank you all very much for coming.